A facelift is a gold standard for patients who need a facelift, but not everybody needs a facelift. I see a lot of patients today who are young, they want something done, but they don't want to go through a facelift procedure, or don't need a facelift procedure. You know, years ago we had to say, come back and see me, you know, in 3 years, 5 years, or whatever. And then you get people who've had a facelift, but they got some recurrent laxity. And our patient this morning, I did a facelift on her 21 years ago, and she came back to and she wanted to be better, but she didn't want to go through a full facelift again. So I discussed it with her and told her we had an option, and she agreed to be here this morning and let us do it. Well, the FaceTite probe is actually a wonderful probe. It's only 1.3 millimeters in diameter. It's 10 centimeters in length. It's easy to use. It's a perfect size to use if you're going to do the face and all of the neck. AccuTite's a little shorter. We'll get to that in a minute. But basically, we're going to keep this simple, but give you the important facts that you want to know for going in the operating room on Monday morning. Here's the handpiece itself. The two electrodes, one that's under the skin, on top of the skin, and the thermistors in these electrodes reading each other. The energy is going from the inside to the outside, simply stated. And the inside probe is covered with plastic, so it cuts down on the chance that you can perforate the skin if you move it too vigorously. Now that's not true with the AccuTite. The AccuTite does not have a plastic tip covering, but this is a basic instrument that we're going to be using on this patient, as well as AccuTite, because there are certain things that I think it's just easier to use a 6 centimeter AccuTite. This is sort of the facelift protocol that we work with. Lower face and neck, mid face, lateral neck, jowls, the two zones. We divide the jowls into above the mandibular border and below the mandibular border. But we have the protocol, but just like everything else we do, if you're doing a facelift, you're going after specific things that you're going to concentrate on. So while this is a basic protocol, if you need to vary it a little bit for that particular case, then you do it. Now, for the tumescent fluid, we're doing this patient under local anesthesia. In the formula that we use most often, solution A, you take a liter of Rhinoplasty, take 15 cc's out of the bag. Why? Because you're going to add 15 cc's of sodium bicarb. So we're back to 1,000 cc's, and then you're going to add 1.5 cc's or 1 to 1,000 epinephrine. So now you've got a solution that's 0.1% lidocaine. And remember the guidelines for lidocaine. How much lidocaine do you give someone is 35 milligrams per kilogram, and that's with the body suction cases. There's no way you're going to come close to that limit with a FaceTite procedure. You just don't need that much. Normally, we're using 150, 200 cc's for numbing up a face and neck. If you need to give a little bit more, you give a little bit more, but you're certainly within the parameters of safety. The good thing about this instrument, the technology, is that it's safety. But at 38 external and 65 internal, that's very safe parameters, and you're going to get a nice change from doing that. There are certain patients, certain skins where I know that Dr. Chia cranks up the numbers a little bit, but we want to do it so it's always safe. Now, after we've done the FaceTite, we're going to be doing Morpheus8. And Morpheus it's great fractional remodeling. It penetrates the skin, the microneedling. And we're going to be demonstrating that as we go along, but it's a great complement to add to the FaceTite. So you're under the skin, and you're on top and through the skin, in the skin with your microneedling. So you're hitting the skin from both directions, both sides, so to speak. Now, here's the mechanism of action of the needles. Obviously, when the needle pierces the skin, there's a little mechanical puncture at the surface of the skin, but these needles are coated. They go down into the skin, and right around the needle you have the zone 1, which is the ablation. Then you've got coagulation just outside of that, and energy that spreads out further. So if needles that you're treating at 4 millimeters depth, you're getting changes, you're getting a heat at 5 millimeters because the heat is going to expand. And this just shows that when you turn up the energy as you would expect, you just get a wider field of influence from the heat. You're going to expand your zone of treatment as you go up in your energy. You get your biggest reaction in the tissue at the surface of the skin. And then it just goes down a narrow cone. With the needles, it's the reverse of that. You get your expansion at the tips of your needles. So you're getting that cone expansion at the bottom where you want it. These are the different Morpheus tips. The first one on your left is the standard Morpheus tip. Goes from 1 to 4 millimeters. Obviously, different patients, we do different amounts of treatment, different number of passes, single stacking, double stacking. You got to evaluate the skin on your patients just like you would for any other procedure. If you're going to do peel or laser, you're going to vary that according to the patient's skin quality and what you need to achieve. But basically, the typical head goes from 1 to 4 millimeters, but it's going to kick off a little heat so you're at the bottom, so you're actually going to get expansion of your energy up to 5 millimeters. And then the next one that you see is the resurfacing tip. The depth of that is 500 microns. I really like the resurfacing tip to finish off. I'll do the Morpheus. Well, my favorite for the upper lip, let's say, is the Morpheus Prime, which is the third one that you're seeing on the skin. It's 12 needles. It goes 1 to 4 millimeters, but on an upper lip, for instance, and we'll probably do that today. It will go start out with a Morpheus Prime, probably go 3 millimeters in depth, and then we'll go back and do resurfacing, which is 500 microns. It's great, great. And then all the way to the right, the new Morpheus Body head. Tell them about it, Lisa. This is brand new, and this is great for the body. Right. Talk about that.
This is brand new. It just came out, and it's 40 pins, and it goes up to, mechanically up to a depth of 7 millimeters. The heat goes up to 8 millimeters. And one of the big advantages of the Body is that we can do something called a burst mode, where we're treating at 3 different levels. Let's say, for example, 7, 5, and 3 millimeters, all in one burst.
Yeah.
And so you're able to get that depth at multiple levels, and it has increased the speed.
So just to augment what she said a little bit, you know, let's say we're doing a regular Morpheus. You push down on the pedal, you can get 1 beat, or if you want to, you get what we call double stacking, beep, beep, and that's what I do most of the time. But then the needles retract, goes from being in at 4 millimeters and comes back into the head. But with the new body, within a new body head, it will go in at 7 millimeters, and then it retracts on its own, 5 millimeters, and treats, and then it pulls back again to 3 millimeters and treats. And you can also do that at 2, 4, and 6 with that appliance, right?
Exactly.
Yeah.
Yeah, we're really excited about the Body.
It's really, and I've seen some of Dr. Chia's worked with that already, and I'll tell you, it does really treat the skin. Okay, our patient this morning is 75 years old. She's in excellent health, and 21 years ago, I did a facelift on her. Lasted pretty well, didn't it?
Fabulous.
Okay.
It lasted great.
But she came back to see me, and she said things are changing, and she doesn't want to have another facelift. She wanted to know what we could do that was minimally invasive, but yet give her an improvement, but without going through the full facelift procedure. So I looked very carefully at her and thought right away we could make her better with radio frequency, with the Embrace procedure, bipolar radio frequency, and Morpheus8 to help change the skin. So let's just mark her a little bit and see the things that I see. So just for lining things up, just part your lips a little bit. So here's her midline, and here's the sternocleidomastoid muscle edge, cervical crease, sternocleidomastoid muscle, and then we see that she has some prominent bands on the front of her neck, and we know that there's a little layer of fat on top of those bands. And I know if I take that fat off the top of the bands, and then we can tighten the skin with the radio frequency, we'll get some contracture there. And so we'll be doing a little liposuction on the bands, as well as the radio frequency to tighten the bands. But we're going to be marking the area that we don't want to do any radio frequency. And the oral commissures, right down, is where the marginal mandibular nerve has little branches that go to the depressors of the lower lip, as well as the mentalis muscle. So we're not going to do any energy medial to the red lines. Now on the profile, just turn a little bit, we can see that she has, let me step over here.
Perfect.
Let's just mark the border of the mandible. And we can see that she has a prominent jowl that's divided in two parts. The part that's above the mandible and the part that's below the mandible. Now let's turn to the other side. And we see the same thing, mandible border, and we see, let's go back to the front so that the audience can see. We can see that that jowl actually extends up on the cheeks. And you see it extends up on the cheeks. And so now you can turn your profile. So we're going to want to get that down, as well as the portion that's below the border of the mandible. Now, she also has some thickness in the nasolabial folds, where we can do AccuTite to help flatten that. It's greater on the left side than the right side. And then on the upper lip, and we see she has significant vertical lines. So we're going to use the AccuTite on the bulge above the nasolabial folds. The crease, we're going to put a little Juvederm in. The marionette lines, we're going to add a little Juvederm. But the fullness, just to the outside of the nasolabial crease, we're going to do AccuTite to help flatten that. And her lower lids have some fine lines and wrinkles. They're not really bad on her, but we will do 2 passes with the Morpheus Prime on the lower lids to get a little bit of tightening. And I think that would give her a nice improvement there. But the area that concerns her most is here. Nasolabial folds, the jowls, the neck, the vertical bands on the neck. Is that right? I saw you shaking your head. Do you agree
Yes.
with that?
Absolutely right.
All right. Well, I think we're going to make all of that better.
I love you.
Okay. In the last few minutes, Dr. Chia has two messed a part of the face for you. So, but I want to demonstrate what we're doing. We just get a little wheel. And
That was just 1% width on a 30?
1% on a 30 gauge needle. And now we're going deep to superficial. Get right down on the platysmal muscle. And then we work up towards the surface. Dr. Chia has perfected this technique along with Dr. Theodore, doing a lot of totally local body contouring cases.
You kind of let the hydrostatic force of the tumescent at low speed kind of do its thing, right?
Yeah, you can just put the needle in place and let the hydrostatic force do the dissection for you. Are you feeling any discomfort?
No, not at all.
Not at all. And you can
Can you
see
let the
from,
audience know that if they have questions to,
Yeah, yes, absolutely.
yeah, if you have questions, let us know.
There's a chat box you can text, or excuse me, you can type into, and then Lisa can relay the questions. Here is a slight delay with the broadcast, but we'll certainly answer any questions you all have. Kind of like barbecue, go low and slow with the tumescent, right, Dr. A?
Go low and slow, low to superficial, and let the hydrostatic depression just do the dissection. And that's how you avoid the pain. That's why you can do these abdomens with the local.
And how much volume do you think you'll use for the
Normally, I would say we use 150, 200 cc's. That's a reasonable amount. It usually accomplishes what we need to accomplish. You can see the infiltration as we go. But other than getting used to doing it yourself, it's that slow fashion manner with the hydrostatic dissection. Pretty straightforward, really.
looks comfortable on that side, real good. Okay.
Mm-hmm. Okay. Probably enough there. Okay. And the jowls and the nasolabial folds are all numb. So we're ready to get started. Now,
Actually, we'll put them on the right a little bit. Just test the right side.
yeah, okay.
Nicolette, you're good?
You okay,
Yeah,
Nicola?
fine.
Okay. We just want to make sure.
Yeah, make sure that she's
Keep us
numb.
honest. I think we're good.
Mm-hmm.
So I think the water is a heat sink because it has a high specific heat. So you have to consider how much fluid you go in. Do you compensate by going more into kilojoules and that kind of thing?
Well, I think kilojoules are important, but I'm more a temperature guy.
Yeah, time and temp.
Time and temperature it tells
I
me
agree.
more.
We're the same.
And
Spirit and I are the same.
And the machine, sound of the machine tells you what you're doing.
Great.
Now,
We'll take a look at the instruments.
yeah, let's look at the instruments. So get a
One
little-
question I get a lot is, how do you choose whether to use the FaceTite instrument or the AccuTite instrument?
Well, that's a very good question. How to decide to use FaceTite or whether to use AccuTite? It depends on the surface area you're doing. Actually, with Nicolette, you could probably use AccuTite all the way, and I'm probably going to do that on neck bands. But
It's basically like a scalpel. You use the blade size that you are indicated for what your area.
that's
you're
right.
doing.
Sometimes you
Like a
need a
canner
10. Sometimes you need 15. Occasionally, you want to puncture the skin with, I'll use 11.
Exactly.
That's
It's
right.
a tool.
But you can see, it's a camera showing these exactly there. We guys can see it on the camera. Okay, so we can see there are probes. We see the electrodes. The energy is going from here to here, going here to here. So, one of the things that I always do is undermine the skin with a cannula, a liposuction cannula, before I put in the handpiece. And I do that because this is a lot more flexible than your suction cannula. But you can undermine, obviously, with this, and some of the video demonstrations show that. And I use, depending on how much I'm going to do, the 1.5, the 1.8, or the 2.4. Now, the vertical bands on the platysma are not something that are easy to correct, and we say we just don't know how to get those as good as we'd like for them to be. But what we know that there's a little layer of fat on those vertical bands of the platysma. We also know that we would like to get skin contraction, but not lose any fat in between those vertical bands. So I'm going to use my 1.5 cannula here in the midline.
That's a 14 gauge hollow needle just for access,
Mm-hmm.
right?
So we have the external temperature set at 38 degrees. We have the internal temperature set at 65 degrees. And then treatment time is really just, we typically set that at 120 all the time. It's that's just the time the foot pedal is active. On the other side of the screen here, we have the current temperatures. So these are the temperatures that we'll watch during the case. We'll also listen to the audible sound, whether they tell us whether we're reaching temperature. And then the last thing you see on here are the kilojoules, total kilojoules. And we'll just make note of that, but that's not really an endpoint that we'll look at during the case.
And this is a trick that you guys taught us, is that you want to make sure you have a working device.
I did teach you that.
And then, so you're checking the internal probe, make sure it goes up. This is the working end. And same thing with the external. And despite what my wife says, I am warm-blooded.
Kinda.
Yeah, kinda. And the 120 treatment time, that's a compliance measure for the instrument indication. That just means that it's your foot's on the pedal, it works. Foot's off the pedal, it's off, just like most of our devices. But it automatically clicks off anywhere from 15 to 120 seconds, so it's just annoying to have to redo it, to just max out at 120 seconds.
Right.
All right. And Dr. Aston, 38 external and 65 internal. Is that good for you?
That's perfect.
Great.
That's perfect.
All right.
Now, I'm going to take now a little of that fat right off the surface of the platysma cords. Then we'll use the AccuTite on that, and then we'll go back to the FaceTite and do the lateral neck. I treat vertical cords on the neck with great respect, because as everybody who's watching knows, it's one of the hardest things to get rid of.
This brings up a good point. So in specific indications, you'll 2-mess, do some suctioning, then RF.
Exactly.
Are there scenarios where you do 2-mess, RF, then suction, or is that?
Yeah, well, in fact, I usually do the RF. Now, let me show you this 1.5 cannula. You can see what I said is right. There's fat on top of that little muscle cord. It goes there. It's coming in the tube. But yes, Chris, most often I will do the FaceTite and then finish it off with the liposuction, because you got a little bit of fluid. Look at the amount of fat in that tube that we took off that small platysma band, and if you look at it, you can see it appears that it's flat. In fact, I need to do a little bit right there, and then we put some energy over top of that and get some skin contraction, and I'll try to get a little skin contraction right between the cords too.
You're pretty much on top of the band, the fat that's right on top of the band.
I'm right on top of the band, yeah. That's the reason we marked them out. I felt those bands about 4 times before it was injected. We talked about them in the pre-op video.
Another important thing that most of the audience are users already know this, but you also don't want to heat too close to the axis incision because you have a tendency to deposit more energy the closer to the incision. Just like we teach the fellows, don't liposuction too close to the axis incision. You may get more suction than you want. You want to deposit more heat than you anticipate.
Yeah, you've got to.
Perfect. Right. So hopefully the audience can see the numbers pretty clearly here and the picture in picture.
Where are we now?
You're 56 and 34, 64 internally. So you're right there. I think the idea here is now that you're at almost therapeutic temperature, and we want to sustain it. And admittedly, these tight corners are hard to negotiate sometimes, but that takes time. But that image with the white to yellow is perfect.
Well, that's just where we want to be, right?
And it also demonstrates as very evenly applied and predictable. So it's 38, 39. That's great. 39. So that's residual temperature is significant.
Okay.
Just infrared image.
What if you're able to reach internal but not external, or vice versa? What do you do in that situation?
I'm sure Dr. But just like we mentioned earlier, so we'll address the first scenario first. The internal is going up first, and then the machine, as it should, limits you, stops delivering the energy, but you find that the external temperature is not up to snuff.
Now she's got a little bit of her submandibular gland right here, but I'm going to treat that area a little bit because with my fingertip it feels like I need to get just a little bit more energy right there.
While you're working on it, there's a philosophical point. With the kilojoules as an endpoint, there's many of our colleagues who use RF every day and have great results will like to use kilojoules, which is totally fine. But we like to do time and temperature. If you're getting your tissue energized, if you will, for an appropriate time that you think is clinically relevant, at the temperature that you think is perfect, then you kind of just let that do its thing. It's kind of like everyone wants 100 degrees centigrade for boiling water for pasta. Once you get it there, you're going to have wildly different amounts of kilojoules, whether it be dinner for 2 or like a pasta party for 10 kids. So the kilojoules will be different, but the temperature is the same, and experience, if you will, of the pasta or the tissues, the heat will be very similar.
Now, I've switched off. Dr. Chia's going to do this because I'm right-handed, and because of the cameras, we want you to see everything. It's easy for him to step in from that side rather than me going over and blocking the camera. And he's demonstrating getting along the border of the mandible.
So I'm happy with the external temperature. I'm going to slow it down a little bit for the internal temperature. So nothing's happening right now. I'm just going to kind of get this whole zone up to temperature. Lots of noise, but it's all good. I want to get this area, and I'm sustaining this for about, 20 seconds or so, just eyeballing the clock. So if you're using a pasta analogy again, it's like if the water starts boiling, you don't just turn it off and throw the pasta in. You let the pasta cook for X number of minutes, depending on how you like it.
Right.
Show your supination.
Yeah, he's going to do that now.
We'll credit Dr. Ravati with this.
Yeah.
So basically, he calls it cephalic rotation, which is basically supinate your hand.
So here's the mandibular border. And Chris is going to, go ahead, Chris.
Yeah, you can explain it, but just pushing it against kind of the inner table, if you will, and go super slowly. We just only care about the internal temperature at this point. We're far from the marginal branch, likely coarse, hugging the mandibular border. You can see that with the camera. You can actually see some of the tumescent being, and just overlapping about 50% for a second pass. Internal temperature only we're concerned about. You want to get that effect. So you see, I'm going to push it this way and then supinate or cephalic rotate. Hold it. Nothing's happening, so we're at good temperature here, actually.
That's it. That's great.
You can see that.
You know this temperature because, and you know, Why don't I switch to the,
Sure.
let's go to AccuTite, and I'll just do that jowl.
The jowl heats up so quickly that this will be an area that I will kind of rely on kilojoules, because you're therapeutic in like 0.1 kilojoules, and I kind of think that may not be enough work. Remember, joules in high school physics is work, and a tissue has to get worked on. And even though your temperature right there was perfect, was 65 plus, and then 37 or 38, but we only got 0.1 kilojoules at that point. Now you're at 0.4, which I think is good. I think I would do half a kilojoule a jowl. Here I will persist. What do you think?
I agree with that. I think agree with you.
You don't want to just sear the steak. You want to get the whole thing.
You want to get the whole
whole
thing.
thing cooked,
Exactly.
Okay,
I think we got it.
0.4 is good. She has a small face.
Yeah.
So I would say, what's your ballpark for kilojoules a jowl, each jowl? Depends on the size, right?
Yeah, it depends on the size.
0.2 to
Sure.
0.5. I think a guy would do at least a half a kilojoule.
At least a half in
Yeah.
a guy. If you've got a big jowl,
Yeah.
sure.
And even one if they're real.
Point 2, 3, and how much did you say machine said we did here?
0.4.
0.4.
So that's, yeah.
That's good.
So sometimes I heat up so
good.
quickly, I could go do the other side, do 0.2, 0.3, and then come back.
Come back to
Exactly,
add a little
yeah.
extra. You can see the difference right now on that overhead of where we've treated here and where we've not treated over
Which will go
here,
next. Yeah.
which it's would seem that it's about
Do you have an 18 gauge,
time
please?
to do.
We could actually use an 18 with that one. So we'll
Okay.
demonstrate that it's such a small device. What would you like right there?
Yeah, right there.
The hardest part of the case is finding the puncture site. Okay,
Yeah,
right
get your
there.
puncture site. But the good thing about this is that
So literally, this is a standard pink 18 gauge. So you have a lot of latitude where you can put your axis incisions, because it's literally an 18 gauge puncture. It doesn't leave a mark. So just like shoot and pull, you want the right angle. This gives you a lot of latitude, like I said, to get the right angle.
I just heard some
Oh,
of that
the crackle,
crackling. You
yeah.
still have that extra microphone? That's okay.
Yeah, we'll give it a shot. Yeah, you actually hear it too. Okay, put it right there, Justin. Get a little closer.
I think it's just thicker on the cheek, on the neck, so you could more likely to hear it.
Oh, I hear it, yeah. I wonder if the audience can hear that. And this side is a lot more. So how about your choice of X incisions? And obviously the no-fly zone is here, and then why not go from here to here?
Well, you actually could go from there to there if you're right-handed. And I've done that from time to time. It's just I don't think that's any reason not to go from there to there. But here you're so close, you're right on it.
Right.
That this little puncture wound will be a non-event. You know, these little round circles, it's just a needle stick. What's the temperature here?
What do you got, Lisa?
65 and 33.
So internal's good. So you obviously know the anatomy like the back of your hand, so you're getting a little closer to and you feel comfortable with that. But for those who are less experienced with facial surgeries, I think expanding that no-fly zone won't compromise the efficacy of the procedure, but enhance the safety, I would think.
Exactly, but I think that we're wide enough there, and I'm superficial
Yes.
enough
Yes, definitely.
at this point, so I feel totally
Yeah,
comfortable.
absolutely.
Nicolette, how you feel?
Good. Thank you, Prashant.
And the other thing is, you could see from just when she spoke that all of her nerves are working.
Perfect.
The
Yeah,
lip-
exactly.
The lip is moving right. That's a good idea, right, Nicolette?
Yes.
Many advantages of local.
Yeah.
So that's 0.4 also, because they're 0.8 total. So we're
there,
symmetric. Yeah, yes, sir.
Yeah. Now, let's look at her nasolabial folds. It's bigger on this side. We're going to do a little bit of heating here.
Are you comfortable, Nicolette?
Yes, fine.
Fabulous.
Okay. I think on nasolabial folds, you have to be very, okay. You have to be very precise. We do not want to apply energy in the nasolabial crease. We want to apply the energy just lateral to it. And her right side, we're just giving her a little bit of treatment because the other side is bigger, and you can see how fast that is heating.
Here, the internal temperature is therapeutic. With it. I have a hard time getting external temperature up here. So I focus on internal here because otherwise I'd be chasing our tail with the external in many circumstances.
Well, I'm pretty close there already, right?
Yeah, you can tell by the tissue color change. She's fair, so you can see it. Yeah.
Yeah. Perfect. Where'd we get to there?
65 and 31.
I like it. Yeah.
I like it. Stop.
So our next question from the audience is, how long do the effects of the procedure last in comparison with a FaceTite? A facelift, sorry.
It's just like all of your aesthetic procedures. Once you've done it, you've reset the clock. You know, 20 years later, you can imagine that if you hadn't done it, what the patient would be like, whether it's a facelift or FaceTite. It's assuming you've done the appropriate procedure for the patient, or you've done the procedure with the outcome you anticipate getting, then you've benefited the patient for life because you've really reset the clock. So when patients say, how long does it last?
Kind of like it's a gap procedure. So, I mean, we all have patients say, okay, I know I need a facelift, but I'm not ready for another 2 years, but my nephew's getting married this fall. What can you do for me? Would this be a good bridge procedure for that?
Now, Nicolette didn't say her nephew was getting married this fall, but I did a facelift on hers 21 years ago, as we said in the preoperative evaluation. And Nicolette, it lasted, didn't it?
It was perfect, yes. It lasted all these years.
That's right.
21 plus?
Yeah,
So,
fabulous.
did my internal temperature go to over there?
65 plus, yeah, perfect. Yeah.
So we're done.
Yeah, done. Yeah, it did 0.3 on that side.
Okay. So we've done the neck, the jawline, and the jowls, nasolabial folds.
I did take the liberty of injecting her upper lip and lower lids where you can see
So we can do some Morpheus.
Yes, sir. Did you want a Morpheus with the larger head, the 20 pin on the neck?
Yes.
And then we'll use the Prime, which is a 12 pin, very accurate one.
Yes, I want to use the.
We'll get that set up.
Well, you know what we'll do?
How do you
Put on.
medicate these?
If you've already got the Morpheus on, I was going to say, I would do the Prime and then have Lisa do the neck if she wanted.
Yeah, that's a good way. Yeah, let's start with the Prime because it's on the lids.
Yeah, because I want to do that on the lids, but.
What are your typical settings?
Well, I think it varies with the skin tight. On the upper lip, I want to start at 4 millimeters, and
Another pair of gloves for him.
I think on this, 3 millimeters. I'm sorry, 3 millimeters here, and I think for the energy you can use it 25 and up. You use 25 on the upper lip, 4 pins.
Well, he too mass, so sometimes I go up a little bit.
I think we
more.
can't compensate for the fluid.
We'll go ahead up.
To 30.
Yeah,
So this is
That's
the
good.
standard
That's-
20 pin,
yeah. Okay.
and what he has in his hand is a 12
Do
pin,
you want it on repeat?
which is a little. We'll
Now,
compare.
look at the. Okay, I need that foot pedal. You have it.
It's nice and it goes for tight corners.
Yeah, look at the difference in the size. Now, here you see the needles. We're ready. Now we want to double stack this, and we we're going at 3 millimeters, and our energy is 30.
That's correct.
Okay.
Can you take off my glasses, please?
I'm double stacking up, getting 2 pulses before I move it.
So, what does double stack and multiple passes mean to you, Dr. A?
Well, you're getting more energy delivered in the same place. You've got to overlap, and multiple passes is sort of like whether you're doing dermabrasion or laser. You're looking at the skin, you're looking at the changes you're getting as you do it. You see, we see a little punctate bleeding there, so you're essentially adding extra energy into the exact spot that you're putting it before you're moving it. So in that half of the lip, we've done 2 passes, double stacked, at a power of energy of 30. Let's do the other half of the lip.
If you were doing this in your office as a standalone procedure, how do you like to numb up your patients?
For a standalone procedure, we'll use some topical and
Regional blocks?
regional block.
And I tell our patients that they'll do a package of 3 and necessary a 4th one, but usually a package of 3. What do you like to tell you?
I always plan a package of at least 3, and I say from the beginning, probably going to take 4, because if we do that, there's not much downtime. So we've done our 3 millimeters. Let's put the resurfacing on.
Okay.
Well, you know what? Let me do the perioral because
You want to do the lids with this first?
Yeah, that's what I said. I'll do the
Perioral, sure.
the periocular, and then now you can take it down to 25 for the lids. Now she has small fine lines and wrinkles on her lids, and this is still at 3.
We'll go to 2 or
Yeah, let's go to 2.
2 millimeters.
Yeah. So on the lids, I'm going to go to 2 millimeters and decrease the energy. The skin is thin. We're trying to give her an improvement and not hurt her.
That's a nice shot.
I-
How you
I-
doing? Okay.
I could feel it.
You feel it a little bit?
We'll give you a tiny bit more.
Let's give you a little bit of local. We gave you a little bit local
Yeah.
long time ago.
Filter on the lip.
Okay. And a little bit closer to the lid margin.
Exactly.
Mhm.
What, half a cc?
Yeah. And I'll inject the other side before.
You can do that. I'll inject this side.
Mhm. Okay, so we've got 1 pass there. Nicoletta, it should be numb now.
Is that better?
Is it numb?
Better.
Hmm?
Better.
Better?
Mm-hmm.
Okay, well, I think that's all. We've got 2 passes, 2 millimeters. Well, she's so thin. You could do 1 millimeter. I'm gonna do a superficial on the lip, but her lids are kind of thin as I was looking at her again. So I'm gonna stick with 2, Lisa.
You okay? Good. There's involuntary orbicularis,
Yeah, you get a little twitching of the muscle
which is comfortable.
from just the energy.
Means it's working.
Okay, that's 2 on both lids. Let's put the resurfacing on and do the upper lip.
Did you feel anything with the upper lip last
Yeah.
time? Okay, I'll give you a little
Well,
more
let's
while
go.
we're waiting.
There's
Yeah.
a little in forward block too. Mm-hmm. It was a little bit numb, as it just felt like you were getting the full force, so to speak.
Kind of like full force.
Okay.
Okay,
Well,
fair enough.
we don't want to hurt you.
What would you like for settings for the resurfacing?
25. Yeah.
So, what are the key differences in resurfacing?
Well, the resurfacing only goes to 500 microns.
Uncoated.
It's just uncoated, and you're trying to get that superficial layer. You're trying to get dyschromias and fine lines. I'm not so often treating dyschromias. It's the fine lines and wrinkles that I'm trying to treat, and so that the first pass, you know, at 3 millimeters, it gets into that dermis, and then we're going to go back and get the superficial skin, if you will. We're at 500 microns.
Is that okay, NeckTite? Perfect. Okay.
So you can see that the pins are fixed.
Yep.
So they're always
The
out.
pins on this, that's what I was looking at, so you can see the pins are already out. They're not retracting. They're not coming and going.
Static.
They're static. Okay.
Good. Better.
Much better.
It's better, huh?
Much better.
That was
Much
my
better.
fault.
Much
I didn't give you enough the first time. You can blame me.
We're using a setting of 25.
Yep.
But hopefully the rest experience was pretty good for you.
Introduce 25. And the result, I think, will be pretty good for you, too.
Excellent.
Now, I'm actually doing 3 passes with the resurfacing.
So basically 6 pulses per area.
That's right.
3 times 2.
Mm-hmm.
Double stack 3 times. What do you like to do with your post-op care?
I put ointment, and on the face, I put a facelift type dressing.
Water-based ointment or petrolatum? Doesn't matter? Or?
We usually use petrolatum because it hangs on a little bit longer. The water-based ones sort of dry up so quickly. Let me just look at her. As I said early on, I do this and I look at the skin. It's sort of like if I were doing laser. I might look at that skin and say, I can do another pass there. I'm going to give her a better result if I do that, and that's what I'm doing now. So I'm actually doing three passes with the resurfacing. Much better, she says.
Another question that came in.
Yeah.
What are the benefits of Morpheus versus a CO2 or erbium laser?
Well, I think the downtime for the same treatment is certainly much higher. I've done thousands of erbiums. I stopped doing CO2 lasers probably about 1.5 years after I did them. I know that Dr. Baker and I went up to Boston to take a laser course, and many years ago, and on a Saturday. I know we were both on the same plane. We said all the young guys will be glad if this plane goes down, but the downtime was just too much for me for CO2, and a lot of hypopigmentation afterwards. Same thing with erbium. I switched to erbium. I've got a lot of patients that did erbium on excellent results. A small percentage of them got hypopigmentation, but the downside is just longer than it is with this. And in my practice today, in 2020, patients would rather come back and have another touch-up where there's no downtime. I mean, you wipe this lip off. We can see a little punctate bleeding here now. You wipe it off and look at it tomorrow, and there's not going to be very much there. It may be a little bit red, but that's it. Let's see, Chris. I think that looks pretty good.
You get the appropriate erythema coming out.
Yeah. You can see the erythema from the
Small punctate bleeding, which we want to see.
yeah, small punctate bleeding all over, which is what you want to see. That's 3 passes with the resurfacing. I think it's time to do the neck. the,
If you want to start it, Lisa can
Morpheus8.
finish it.
okay. Let's just change heads. But look at that overhead picture there. You can see the jawline contour. If you compare that with the pre-op, that's pretty significant.
We turn her gently this way.
Uh-huh.
Just in the shot can consider a profile.
Okay,
Right. All right.
So I have it set at 3 millimeters,
okay.
energy of 35, cycle, meaning the pins come in and out,
Mm-hmm.
and
Okay, here's the normal Morpheus8 tip. You can see the pins. We're set at 3 millimeters, and then you got 35. Is that what you said?
yes.
Okay.
Lisa, we talked about number of pulses. What do you think is an efficacious number of pulses for a standard neck size?
So with an experienced user, so me personally, I've been using, well, I used the first device, Fractura, the sister device, the first generation, since 2015. So I'd say I've done a few of these treatments. I typically will do 1,500 pulses on a face and neck. I would say anything under 1,000 might be under treating it, but again, you're always looking at that skin
You okay?
to see the response.
perfect.
So
Some of our audience members, when you first said that to me, I thought, well, that's a lot.
Feel anything.
But you
It is a lot.
really believe that they need. So you would rather do more passes, more total pulses than say crank up the energy, or
Yes.
or some combination therein.
yes, and I'm always adjusting energy. I'm looking at their skin. I'm looking at their skin reaction. If I feel like I could do the 24 pin at all 3 layers and then do the resurfacing, I'll do that. But most of the time with the aggressive treatment I do the resurfacing pin at a whole different setting.
Is that what you do, Dr. Aston?
Yeah, I agree with that totally. And I started out with Fractura too.
Yeah. You did
Yeah.
tons of Factura
We
before.
did tons of Fractura. Yeah.
You do it yourself, though, right?
Yeah, I do it
Yeah,
myself.
which is relatively rare.
The reason why I like the Morpheus over the Fractura is I feel like the pins are elegantly shaped compared to the Fractura. They're a little more blunt.
Oh,
Do you agree?
Oh yeah, no. This is a much improved device in my hands. I think it's the one to have.
The winner.
Yeah, this is a winner.
And
How about durability of the pins? If you're doing 1,000 pulses, how long are they good for?
typically we'll tell people we should change out the pins after about 2,000 pulses.
2,000. Okay,
Yeah.
so you got plenty of life.
And part of that depends on where you are on the body and their skin texture. If you're on, their abdomen and they have a really thick epidermis, you may want to switch it out before that.
You know where we're using a lot is axilla, suprapatellar skin, and even at lower abdomen. For those cases, they don't want to have anything else.
So my pearl for the knees are also treat the lower thigh.
All right,
You'll get a lot better results.
I've got 3 passes double stacked on the right half of the neck. Okay.
I feel that.
Feel that a little bit? You don't feel this, so.
No.
Yeah, we don't numb the mentum. So if we do this, I guess
I just came up a little high on that.
So I think the other thing that I do is I do a tight overlap. So I overlap mine by about 70 to 80%, which might be a little more aggressive than what
minimum is
most
50.
people do.
right?
Minimum is 50, but
I'm trying to get about 50.
But by doing a second pass, you're randomizing it, so you should be getting it.
There's no question but what you're doing something.
They're at 318 pulses. She has a small face, so this is good. Yeah.
Mm-hmm.
But even in someone as small as she, you would do 1,000. Yeah.
We're doing their full
Yeah.
face and
It
neck.
makes sense. It makes
1,000 to
sense.
1,500. It's typical.
Okay, so we've got the right side of the face with the 3 passes when I finish here at double stack.
Now, do you typically do multiple levels, or do you just use the 3 millimeter on the
I do different for different people. Her skin is sort of medium. It's not thick. Certainly, it's not thin. But we were just under there with a cannula, so we've got some hyperemia with that. We've got all of this is done 3 passes at double stack. All right.
Great.
All right, Lisa, you want to do the left side of the neck and the cheeks?
Sure.
Demonstrate your technique.
Sure.
So, while Lisa's doing that, if we have any questions from the audience, let me check the chat box here. Yeah. We got some good questions. I think we addressed them all. So far.
She finishes that, we didn't take any liquid out from under you. I think there's any reason to put a camera in there.
Oh yeah, well if you wanted, I usually suction it, but the volume of the neck, if it's purely just to take the liquid, I'm not concerned about it.
Yeah.
Yeah, I can just milk it out, or
She might look and see if she
Yeah.
needs a little touch there.
sure. I didn't close the I just closed the submental. You can take that out easily.
Yeah.
Yeah, so we'll wrap up with a little finesse liposuction.
Just a little finesse liposuction
Mm-hmm.
along the jowl, if we need it. I want to go back and look at it.
Sure.
Sometimes I do, sometimes it's good. I'll use a 1/8.
The little guy.
Yeah.
Feel that one? How about that?
You need a little local there?
Any
I think
better?
she's good there.
Are you good there? Okay, good.
All right. Well, any closing comments? I think you can do a little finesse liposuction, but we don't need to probably see that portion. But
Yeah.
for our audience members, I think this was a really nice summary of what we can do with the entire facial treatment, basically, nearly.
Exactly. And
that
it's
okay?
just, it's good to have this in your armamentarium to be able to offer it to people who don't. I mean, is she going to have a little bruising? Yeah, maybe. And we talked about that earlier today when we were marking her. Yeah, she may have some bruising, but she's not going to have any incision lines to heal. She's not going to have stitches to take out. And if she has bruises go away. I mean, I don't think, 10 days, it's going to be gone most likely. But I think that it's a great change. We've changed the quality of the skin, the contour of the face, and what are you trying to do with the facelift? You're trying to do
The same
changing
thing.
your skin if you can, and you're trying to change the contour.
Correct.
So we've done that.
And with
If
the
I-
RF, you get vector change too. The vectors.
Exactly. And a facelift per se is not going to change the quality of the skin. It will redrape the skin. It'll make the skin tighter. You can make creases and folds and that sort of stuff look better. But here we're actually getting subdermal adipose remodeling. We're getting contraction of the fibroseptal network, pulling that skin down, tightening the skin. And I think it's just a great procedure to have in our armamentarium. You just have to use it and get used to using it.
It's easy to learn and
It's
just
easy to learn.